better, the level decreases. And it has negative influence in glycemic control. It could be because of there are vitamin D receptors which are present here and are calcium hormones, and they result in destruction of the beta cell. The vitamin D has got a protective role. It has been postulated that it has got a protective role for the beta cell mass. If vitamin D levels are less, the patient beta cells are more exposed to the inflammatory insult, resulting in the destruction of beta cell mass. So this is an important thing which has been seen, the role of vitamin D in the management of diabetes. Similarly, vitamin K, pyrroquinone and inoquinone 4, they are present and they have got a definite role in the thrombosis, but they have got another important role in the management of insulin sensitivity, glucose tolerance, and reduces the risk of vitamin D. Most of the Japanese people, they are consuming some diet which is very high in vitamin K2, and which has got a very crucial effect on development of diabetes. So these are the different new thoughts in the prevention of diabetes. But let's show what new approaches we can adopt for the management. Internet. All of you are using internet 24 hours a day from the clock. सुबह सोने से पहले और उठने के बाद सबसे पहला काम मोबाइल पे व्हाट्सएप चेक करना है कि क्या हुआ, what happened. So these internet programs can be designed with the intention to modify the lifestyle and encourage the patients to be motivated for the consistency in the changes. There are patients who will exercise they will do it for 1 week, they will do it for 2 weeks, फिर किसी की शादी आ जाती है, फिर कहीं और जाता है, consistency is lost. Adherence to the healthy behavior over the time is the most desired and difficult behavior intervention. Our internet-based can help achieving these targets. जैसे मेरे पास एक मोबाइल है, उसके अंदर वो है हेल्थ वो कलम गिनता है, so it counts the steps. So my target is 6,000 steps per day, but कभी मैं 10,000 भी कर लेता हूँ. So on the day मैं 10,000 कर लेता हूँ, I'm very happy. So this is one thing which can be used. Web-based interactive module processing, जैसे कि हम different किस्म के courses करते हैं internationally, हम interactive module बना सकते हैं. We can have free support groups, patient to expert interaction, knowledge in the simple comprehensive language. There could be apps, they are going to help the people when they have got questions regarding their diabetes. They cannot go to the doctor, they can talk to the expert, and that will help them while they are sitting in their home. The objective should be that we are going to use internet in a constructive way. Web-based strategies provide a wider option for facilitating the self-management process after clinical setting. When the patient comes to me, he's already scared. His blood pressure is up, he has got tachycardia, and he says, I don't know what is going to say. Whatever advice I give to my patient, 50% is already lost in the clinic because he has got so much anxiety and other things that he is not able to answer the patient. The same information can be given to this patient while he is sitting in his home with the help of the web. And these type of apps, they are going to encourage not only the continuation, but they can make a group and they can have a healthy competition among themselves. As I have said that when I look at my age group and then I say yes, I am doing very well because I am always in the above 30 group. So these type of web-based interventions are designed throughout the world. They can be designed here in Pakistan instead of wasting on rubbish which is present in the internet. You can use the internet in a healthy way. This is something of very rapidly evolving field in the management of diabetes. This is known as nanotechnology. Nanotechnology is not only in diabetes, but it's more on the chemotherapy, because there are a lot of studies that have been done to utilize the nanotherapy for the delivery of drugs to the exact site where they are needed. What are nanoparticles? They are less than 100 nanometers. Nanotechnology-based approaches have got a lot of potential. If you go and search about the chemotherapy, you will be surprised to know that how much work has been done on this. Nanoparticles and nanoscale particles have many physical, chemical, and biological properties. So one thing which we can use is supraparamagnetic iron oxide nanoparticles. They are small nanoparticles, and they are they iron and oxygen, and they have paramagnetic properties. So these are used as contrast in MRI. What is the function? We can use these to see the beta cell mass. आपके beta cell mass आपके पास कोई भी तरीका नहीं है जिससे आप पता लगा सकें कि सेल में beta cell mass कैसा है. These nanoparticles, they can go into there and they can be used as a contrast in MRI, and they can tell you how much beta cell mass is present in these patients. They can be used to develop effective measure of the glucose level as well. A glucose sensor made of nanoparticles, they comprise of glucose oxidase, glucose binding proteins, and glucose binding small molecules. And they can detect the blood glucose level without the regular chemistry. Okay, थोड़ा मसला है आप लोगों से बहुत शुगर चेक करो तो कहते हैं कि हमारे प्रॉब्लम होती है, तो we can use these nanoparticles. So these nanoparticles are used as a contrast in MRI, so that we can have a good image of the beta cell mass, and we can identify when this patient is going to need insulin. And we can ask if it is being used for this checking the blood glucose level. यहाँ तक तो सबको पता है. Therapeutics में क्या काम है? Another concept, new concept is the glucose sensitive insulin, a glucose responsive insulin. How to give a glucose responsive insulin to the patient? 24 hours blood sugar की monitoring is very difficult. The continuous closed loop systems they have been developed, but these nanoparticles, they have got something very new phenomenon. And they can be in patches, and they can check the blood glucose, and then the glucose responsive vesicles which are containing insulin and glucose oxidation. As hypoxia sensitive vesicles, hyperglycemia consumes oxygen, and it becomes hypoxia, which results in the break of this vesicle and insulin is released. What happens? The vesicles are containing insulin, and they check the blood glucose level. This is on the insulin patch. Something new has been done with this, and that is known as nanogels. It is being injected. It goes into the blood, it remains there, and whenever there is a hyperglycemia, they release the insulin. They are going to decrease two things. One, multiple injections. Second, the checking of blood glucose. They are very smart. They are insulin responsive, glucose responsive insulin. Whenever there is hyperglycemia, they will release the insulin. Two injections will be needed. They are nanogels which are being circulating into the body, and only two injections is needed. A person can jog, person can eat, person can have a good life. The glucose responsive insulin is present in the body, and it will check when the insulin has to be released, and if they are released. So this technique, this insulin nanogel, is the latest development in the management of type 1 diabetes. Gene therapy was important. It was thought that it can help. There are so many vectors which are present, and they are using different trials, but अभी तक कोई वो नहीं है exact, but the gene therapy is still going on. Yes. The pancreatic islet cell transplantation has been done. It has been, I think, more than 30 years. So it's been done. Edmonton protocol is being followed by the Shapiro and Steele, and there have been a lot of pancreatic transplant in which the patient remains essentially independent for so many years, 6 years, and later on they do require insulin but over there. So another thought is using stem cells. And stem cells, they are using stem cells from the placenta, they are using stem cells from the bone marrow, they are using stem cells from the mesenchymal cell, and it can provide a prolonged source of beta cell polymerase secretion. This is gene therapy has been used for in the management of diabetes, especially the type 1 diabetes. These are the few new medications which we are going to get. Triazepatide is going to be marketed in 2024, and this SCO-094, which is in the process of getting FDA approval. This is most probably also going to be marketed in 2024. So in conclusion, diabetes is a major problem. There is no permanent cure, and there are many treatments which have been devised for the management of diabetes. The need for the optimal metabolic regulation of blood glucose, blood pressure, body weight, and avoidance of the diet which can have bad effects, especially the high fat diets or these high carbohydrate diets. You can have a better life. There are researches which are going on in the field of the management of diabetes, and perhaps there are going to be some good news in the later decade. But the point is that we still have to identify those who have got pre-diabetes, and we give them a lifestyle modification and other supporting management to prevent the development of the disease. Thank you very much.